Hello, my name is Dr. Alexander Neubauer, and in this presentation, I want to give you more information about cavitations. In my opinion, the most unrecognized danger in your jawbone. So let's go directly into the subject. So what are cavitations? And there are different names for cavitations. In Germany, we call them NICO, or in America or England, they call it FDOJ. So the summary is cavitations. And what does it describe? Cavitation means a chronic inflammation in the jawbone. And therefore, to show you and to explain you, I have two pictures. On the one side here, you see the healthy jawbone. You see on the left side of the picture, you see a healthy bone, which is highly mineralized. It's a very strong, healthy bone, like you would expect. And on the right side, you see a jawbone with a black hole, and you see all these small holes, and it looks, from first sight, I think you agree with me, it looks not really healthy. There is something going on. And what you see here, this is the typical picture, the clinical diagnosis of a cavitation. So when we talk about cavitations, we talk about exactly about this hole in the jawbone, which is filled with a lot of stuff we do not want to have, especially not inside our jaws. So, but how and when is a cavitation created actually? So how does it come to this diagnosis and to these big holes in the jawbone? So normally it all starts with the tooth, and especially with the tooth extraction. So in the left side, I painted for you a tooth, and if we extract the tooth, you can imagine that inside the jawbone, there will be a hole. The hole is there where the roots of the former tooth have been. So after each tooth extraction, first of all, and that's natural, you will have a hole in your jawbone. And then we have two ways. Way number one, the way above here in the presentation, is the way of the perfect natural healing, which we all would like to have. So in the first way, um, the first thing happens is that blood vessels are growing inside here. The hole is filled up with blood. The blood is building a blood clot, and new blood vessels come here from the jawbone inside the hole and create, first of all, a blood clot, and after that reorganizes the blood clot into new healthy bone. So this is the normal way of healing if everything works perfectly. But in the cases of cavitations, there is a big difference. So let's start here again. So you see here, there is again the hole after the tooth extraction. And in our way two, the body does not create new healthy bone here. What the body creates is just a tiny closure with the gum on top of this hole, but the hole inside the jaw stays a hole. There is no blood vessels, there is no blood clot, and there is just a hole, and this hole will be the new home for bacteria, viruses, toxins, heavy metal, Borrelia, and everything like this. And I show you why in the second phase, why did the proper wound healing, why did it not work in this case? So let's start with the characteristics. So again, on the left side, you see the healthy jawbone, and here you see the typical cavitation inside the jawbone. So what about the characteristics? A cavitation does not hurt. It's a chronic inflammation. So you don't feel pain, but the infection and the inflammation is there in a chronic stadium. And inside these cavitations, represents a depot for bacteria, viruses, fungi, heavy metals, Borrelia, and glyphosate. You can call it also a hazardous waste dump. And also in the cavitations, there are inflammatory markers, for example, Rantes. Maybe you heard already about this marker. And the Rantes is it's an inflammatory marker which leads to silent inflammation. So this means your whole body system comes to the state of a silent chronic inflammation, which is not good because this puts a lot of stress and strain on your immune system for 24 hours, 7 days a week. And a silent inflammation and a chronic infection anywhere in your body, and especially in the jawbone, costs you a lot of energy because the immune system has constantly fight against this infection. And if the immune system is constantly on fire and is constantly working, this costs you a lot of energy and makes you feel weak or tired. Your sleep won't be very good, and you will be tired actually all the time. So, and also these cavitations can act as an interference field and affect or impair other organs or bodily functions, for example, via the meridians. So I brought you here the dental correspondences between teeth and organs, or the organ functions. And I made you an example here. For example, this is the wisdom tooth area. And you see if you have here an infection at the wisdom tooth, your energy balance might be affected, your nervous system, the heart, the cardiovascular system, the ileum and allergies can be affected, shoulder and elbow pain. And so by having an infection through a cavitation, of course, the meridian which goes through this area transports or delivers less energy to all organs which are also connected to this meridian. So what are the causes for cavitation? As you remember, the thing is that when the tooth is extracted, we have a hole, and in the case of cavitations, the hole does not fill with a new bone. So we call it, in medical terms, it's an insufficient ossification, so new bone building after removal of teeth. Mostly it's about wisdom teeth. So why is that? One reason is a wrong or insufficient extraction technique performed by the dentist. Or, and this is also one big subject, it was at the point of the surgery or at the point of when the tooth was extracted, there was a vitamin and nutrient deficiency. So the body, for example, did not have enough vitamin D3 or other nutrients to grow and build new healthy bone. So if he has a lack of vitamins, the bone is not able to fill up the hole after the extraction with blood, with vessels, with new healthy bone. Okay. So how do we make diagnosis for cavitations? And this is important. We need definitely a 3D X-ray, so a CBCT scan. Why do we need that? Because this is so important to know the size and also the anatomical position of the cavitation before the operation. So I brought you a picture of a three-dimensional X-ray of a CBCT scan. And you can see here, this is the jawbone, and this is the cavitation here. You see the black area here. Normally, everything should be here very white. I made it like this, and you see this is the hole, the cavitation hole of the infected jawbone, and it's about 1 or 2 cubic centimeters big here. So what about the therapy? How can we deal now with the cavitations? So before operation, the vitamin D3 level should be increased at the time of the surgery up to at least 70 nanogram per milliliter to enable your body to build and grow new bone for healthy new bone. So how can we do that? You can adjust your vitamin D3 level by attending your physician or alternative practitioner, or you can use also our bone healing protocol. So we have designed it especially with the right vitamins and nutrients in order to create a high level of everything what is needed within 4 to 6 weeks. So start supplementing your nutrition and try to increase your vitamin levels. And 14 days before the operation, please have your blood checked and report to our clinic the blood value for your vitamin D3 so that we can see, is your vitamin D3 level perfect, or does it have to be more high? Do we have to increase it? So if it would be too low, we have still 2 weeks more, and you get advice from us how to increase your vitamin D3 level so that at the day of surgery, your vitamin D level is perfect. And this is very important because we need the vitamin D to build new bone, to let new blood vessels grow inside the hole where the tooth has been before, in order to avoid any infection and in order to create new healthy bone at this place. So when the vitamin D is perfect, then you can come to our clinic and we perform the surgery. And the surgery are actually 3 steps, and it means we have to open the area, we have to clean it, and we fill it. So opening is the first step, of course. We do it under local anesthesia. So we open the gums approximately 2 to 3 centimeters maybe, and then we make a complete and gentle removal of the inflamed areas, so of the cavitation, by using minimally invasive and very gentle ultrasound technology. So this is very important. The ultrasound technology, we call it piezo surgery, is a very highly effective therapy which removes the infected parts but does not touch the healthy parts of the jawbone. So this is the cleaning, and after we have cleaned it, we make a disinfection with ozone, which kills all bacteria, viruses, and fungi inside the cavitation. And then we have a hole which is now sterile. It's disinfected and perfectly cleaned. And now we put in PRF membrane. So PRF is, you can imagine, it's plasma membrane which we obtained from your blood. So before the surgery, we draw blood, make a centrifugation with your own blood, and thereby we gain the PRF membranes. And on the middle picture here, you see how the membranes of PRF look like. And what is special about the membranes is that they contain a lot of healing cells and stem cells. So and that's why we put these membranes inside the cleaned surgical area and fill it up with the membranes and then make a safe closure with stitches, which are self-dissolving. And then we cleaned it and we filled it and we closed it again. And now the body has the chance, again, like you see on the right picture, to create new healthy bone where the former cavitation has been. Directly after the surgery, we also use neural therapy, which is 3 injections in the surgery area, uh, which also helps to better healing and also is very, very effective in avoiding scars and for better healing, you can say. So as we do a surgery, I have to inform you about the risks, and I give you as a kind of legal thing from the law I have to do, and I give you the main risks of this surgery here in this presentation, and the detailed description of the surgery you will find on the surgical consent form, which we send to you in advance, of course. So just to give you an idea, we perform thousands of cavitation surgery, and we have never had any complications or risks, which you see here, just to give you an idea. But nevertheless, I have to mention them. So complications are very rare and occur when usually in the form of a more severe swelling with restricted mouth opening and slight difficulty in swallowing. So these complications usually subside within a few days without any additional measures. In very rare cases, during operations in the lower jaw, the nerve in the lower jaw can be irritated, resulting in a temporary or permanent numbness in this area and the lower lip. In the upper jaw, it can lead to an opening of the maxillary sinus, which usually occurs without complication and heals on its own. An infection and inflammation in the maxillary sinus could be the result. As with all surgical procedures, post-operative bleeding and wound healing disorders might occur, but as I told you, we have never some of these complications. So summary, what was the most important? So you should remember cavitations can be regarded as strong pathogens, but are not yet recognized by conventional medicine. So this is the reason why you should visit a biological dentist, a specialist in this field, because he can help you in diagnosis and in therapy. As a hazardous waste dump, they can bring the body into a state of chronic inflammation via inflammatory messengers. So this is the basis for many diseases of our time, like cancer, allergies, autoimmune diseases, diseases of the nervous system, and many, many more. A rehabilitation, according to a biological concept, relieves the immune system and can thus contribute to the alleviation or even cure of serious diseases. So that's why we're doing it. Okay, we not only just want to have your healthy bone, we want to have a big, big impact on your health situation. We want to have a big, big improvement of your health, and that symptoms you had before will disappear. This is our aim, and this is what we are going for. So the costs for the treatment are usually not covered by health insurance companies or private additional insurance. And to give you an idea, the surgery time, for example, for 4 cavitations takes about 2 to 2.5 hours and is usually performed under local anesthesia. And of course, if you want, we can do also the treatment in sedation, or narcosis is also possible. So if you want more information about the surgery and everything we do in the surgery, I advise you to watch the video with the title "The Biological Surgical concept of Medident Bavaria, because in this video I will explain everything what we have been building around the surgery in order to get perfect healing results. So for more information or contact, you can use, of course, our website. I wrote also a best-selling book. It's only available in German at the moment. The title is in English, The Secret Power of the Teeth, you can translate. Please watch also on our YouTube channel. We have there various English videos too. We've got a German podcast. Of course, you can follow us also on Instagram and Facebook. And we offer you a free expert webinar. It's also in German language. So I hope I was able to show you what cavitations are like and how we deal with this severe, not only dental problem, but medical problem. And the bad thing about cavitations is that almost, I would say, 90% of the people have them. And I think 0% knows about that. Why? Because it does not make any pain. It's painless. It's a typical sign of a chronic infection. You know, chronic infections are mostly painless versus the painful acute infection. This makes it so difficult for the patients to make it clear, do I have cavitations or not? So this is why you should go to a specialist in biological dentistry to make a perfect diagnosis and to make a perfect therapy in order to gain back your energy and to gain back your healthy life. So I wish you all the best, and maybe we see once here in Tittling in southern part of Germany in Bavaria. I wish you all the best and see you maybe next time. Bye bye.